Hello everyone, you're very welcome to today's training session, preparing to reopen your school age childcare setting. My name is Breed Stuffy and I am Play Participation Officer in the Bright Start team in PlayBoard, and we also have Maria Hammond and Frances Walsh from the team today. As this webinar is being recorded for GDPR purposes, we have switched off your cameras. We've also muted your microphones to reduce background noise. And if you have any questions throughout the session, could you type them into the chat feature at the bottom of your screen? It looks like a small speech bubble, and we'll get through as many questions as we can at the end of this presentation. This training is designed to assist projects who have been closed during the COVID-19 pandemic, and will take you through the steps for reopening your project. It will become apparent, as with our new way of living, the normal way of operating your new school-age childcare project will have changed, and we now have our new norm. This training also will be based on version 4 of the COVID-19 guidance for daycare and school-age childcare, published 1st of August 2020, and is subject to change. The key change in version 4 of the guidance is the removal of the requirement to operate PlayPods. However, it intends to retain the fundamental aim of the concepts of a pod, which is keeping children and adults in consistent groups, and to, as far as possible, prevent the mixing of groups in each setting. The core public health agency measures that underpin reopening are enhanced hand hygiene and cleaning practice, caring for children in consistently constituted groups, minimising contact between these groups, maximising the use of outdoor spaces, physical distancing between adults and older children in the setting, including parents at drop-off and pick-up times, and active engagement with testing and tracing. Here are some steps and processes to assist you in reopening your project. The first step, begin by consulting with your families to gauge need, and then your local trust early years team to reactivate your pre-COVID-19 certificate of registration. Ensure your committee, your board or owner, management and staff to become familiar with PHA advice on COVID-19 and the version 4 of the Department of Health guidance, paying particular attention to infection prevention and control. Prepare your management plan, including reviewing your policies, procedures, and risk assessments. Step 4, the implementation of your plan and promotion of infection prevention and control in your setting. And step 5, what you can do to inform and encourage your families and communities to help. We'll go through these steps one by one. If you just bear with me, thank you. Step 1, begin by reaching out to your parents to gauge the need in your community. Contact your Health and Social Care Trust Early Years team to reactivate your pre-COVID-19 certificate of registration following the temporary suspension of your service due to COVID-19. Your Early Years team will ask you to complete and submit a registration reactivation form, which is available on the Family Support NI website. And they'll be seeking information about your plans to provide care as safely as possible for children, including how you will adhere to the guidance. The turnaround of this can be as quickly as 3 or 4 days if all goes well. And the public health measures we will be discussing may have an impact on capacity, as in how many children you can safely provide places for. And that impact may differ from project to project, depending on the physical layout and staffing approaches in each of your settings. You should assess what capacity is available before making offers of placements to parents. And what you need to consider when assessing capacity would be your physical capacity. The physical capacity of your setting may be affected by public health measures, including limiting children's interactions, ensuring physical distance for adults, and enhanced hygiene practices that you will be implementing. You will need to review the layout of your setting and consider how many children can be accommodated safely at any one time while meeting these requirements. There is a possibility that this may be below the normal registered capacity of your setting based on current floor space requirements. You also need to consider your staff capacity. The staffing requirements may be affected by public health measures. Staff may also need to clean play equipment, etc., on a more regular basis, as well as monitoring and supporting children's hygiene practices. You need to look at potential absence and reduced staff availability due, for example, to self-isolation. This may also affect your capacity to deliver services. And consideration should be given to the impact on vulnerable staff. Providers should review staffing and consider how many children can be safely accommodated throughout the day. Your hours of opening may also be affected. Settings across Northern Ireland operate a range of models, including term time only or all year provision, and longer or shorter days. And depending on how, what way the schools are going back, your local school provision, you may need to consider, if appropriate and deliverable, extending the opening hours of your setting each day or across more weeks of the year. This may offer more provision, which could enable more children to attend. Step 2. Familiarise staff and committee with version 4 of the guidance notes, which you will find on the Family Support NI website. At an early stage of the pandemic, it was recommended that children were placed with within PlayPods with a maximum of 12 children in each pod. This is now changed and subject to continued reduced rates of COVID-19 infection. This requirement to maintain children in PlayPods of 12 is no longer required. Instead, childcare settings are required to organise children and adults in consistently constituted groups and prevent the mixing of groups. The intention is that the same staff and children stay together each day through the day as far as possible, and to limit the number of people a child has contact with. This will also facilitate tracing and support close, positive interactions between children and play workers. This system will also reduce the amount of contact adults have with each other. Staff team also need to be familiar with the COVID-19 infection prevention and control document, and all staff will need to complete the COVID-19 infection prevention control self-assessment tool and other COVID-19 related training. The main aim of this training tool is to inform staff of the most up-to-date information on infection prevention control, by minimising contact with individuals who are unwell, by ensuring that those who have coronavirus symptoms or who have someone in their household who does, do not attend childcare settings. Cleaning hands more often than usual, wash hands thoroughly for 20 seconds with running water and soap and dry them thoroughly, or use alcohol rub or sanitizer, ensuring that all parts of the hands are covered. Ensuring good respiratory hygiene by promoting the catch it, bin it, kill it approach. Cleaning frequently touch surfaces, often using standard products such as detergents and bleach. Minimising contact and mixing by altering as much as possible the environment, such as room layout. Implementing the pod room system and timetables such as staggered break times, etc. Posters on hand hygiene, which should be displayed in your setting, are available for download from the Family Support NI website. Step 3, your management plan. Things to consider when updating and implementing your regular risk assessment in relation to COVID-19. Along with your staff, management team, committee, board of directors, you need to develop risk assessment in the context of COVID-19. Excuse me. You will also need to amend relevant policies and or develop a COVID-19 policy before the trust will allow you to open. As managers, you must ensure that risk assessments are carried out in your setting, and you're expected to consider all risks identified in relation to COVID-19 while taking account of the relevant guidance from the Public Health Agency. All risk assessments must be reviewed regularly, and as circumstances change, settings should ensure that they implement pragmatic and proportionate control measures which reduce risk. You should have active arrangements in place to monitor that controls are effective, working as planned, updated appropriately considering any issues identified and changes in public health advice. Staff should be consulted in the development of these risk assessments. Plans and risk assessments should also be communicated to parents and all staff, including staff who are employed by your setting but do not provide direct care to children, such as your catering and cleaning staff. PlayBoard have produced a risk assessment webinar, which will take you step by step through developing your own risk assessment. And you will also find sample COVID-19 risk assessment templates on the Family Support NI website. You need to develop a plan of procedures if a child or staff member becomes sick. This plan should cover procedures for contacting parents immediately and criteria for seeking medical assistance. Designated areas where sick children can rest, be isolated and attended to by a limited number of trained staff. If direct care is required while waiting for the child to be collected, you should wear PPE, a mask, plastic apron and gloves. And if they need to go to the bathroom while waiting to be collected, they should use a separate bathroom if possible. The bathroom should be cleaned and disinfected using standard cleaning products before being used by anybody else. And in an emergency, call 999 if they are seriously ill or injured or their life is at risk. Do not visit your GP, pharmacy or urgent care centre. Also, a contingency plan put in place should any of your staff members become symptomatic whilst in work. If a member of staff in a childcare setting becomes unwell with a new continuous cough or a high temperature, 37.8 or higher, or has a loss of or change in their normal sense of taste or smell, they must be sent home immediately and advised to follow the COVID-19 guidance for households with possible coronavirus COVID-19 infection guidance. Excuse me, just taking a drink of water here. Safeguarding and paediatric first aid. Minimum standards relating to safeguarding continue to apply, including requirements relating to child protection arrangements. You should consider whether any review of your child protection arrangement is needed, including policy and procedure in light of the coronavirus outbreak. All planned activities should be risk assessed using the risk-benefit approach in conjunction with relevant staff and consideration given to how usual practice may need to be adopted. Paediatric first aid, the minimum standards require that at least one member of staff with up-to-date paediatric first aid training is present at all times. This requirement remains unchanged. The Department of Health has permitted some temporary relaxation of some of the minimum standards in relation to the following issues only. The requirement to have children aged 2 and under in a separate room. This is in recognition that it may be preferable to have children from a family group cared for together. The current guidance on mixing age groups, this is to permit children of different ages to be mixed in small play groups. The ratio for mixed age groups should be that for the middle age range in the group, or where there is only 2 age ranges, it should be the ratio for the largest proportion of children. The requirement to have 1 toilet and wash basin for 10 children is lifted, and providers are asked to minimise the shared use of these facilities across groups as much as possible. Please note that the Department of Health will wish to return to full implementation of the minimum standards as soon as possible. Early years teams may also carry out inspections where appropriate, and the resumption of the process of routine inspections will happen from September. Further policy review. Other policies that may need reviewing include your return to work policy, your play policy, your risk assessment policy, your absence of manager policy, your staff development and training policy, your behaviour management policy, and your special needs policy. Step 4, implementation and promotion of your infection prevention control. And you can promote this in your setting by minimising contact with individuals who are unwell by ensuring that those who have coronavirus symptoms or who have someone in their household who do not attend childcare settings. By encouraging the cleaning of hands more often than usual, wash hands thoroughly for 20 seconds with running water and soap, and dry them thoroughly, or use alcohol hand rub or sanitizer, ensuring that all parts of the hand are covered. Ensuring good respiratory hygiene by promoting the catch it, bin it, kill it approach with staff, introduce personal and general hygiene rules with staff, such as when they arrive at the setting, that they wash their hands in designated area. When they finish their shift for the day, that they shower and change clothes as soon as they arrive home. Inform them what to do if they cough, sneeze. Ensure that you open windows to ensure good ventilation. Promote and avoid touching your face, particularly eyes, nose and mouth with your hands, and continuously encouraging frequent hand washing, etc. How do we help and support children and young people in understanding these public health measures? Participation should be an active and ongoing process involving children in decision making, from day-to-day activities to wider decisions about how the project is run. We need to ask the questions: do our children have a meaningful role in our setting? Are activities initiated by children supported by play workers? Do children who attend our projects have some control over the resource budget allocated to it? These new boundaries, including social distancing of groups, rooms, play quads, better hygiene and hand washing, as well as appropriate behaviour, work better for all when discussed, negotiated and agreed with our children. Children need to know their participation is real. Helping our children and young people to understand the public health measures. Staff can involve children in the discussion on how to promote good public health practices in your setting. You can use symbols, posters, social stories and videos, which you can find on the Family Support NI, Public Health Agency site. Parent NI, you can find a lot of the social stories and videos there. Teach by example, frequent hand washing, social distancing, and with younger children especially, using songs and rhymes to get these messages across. We can encourage the children to tell you if and when they feel sick, promote good sneezing and coughing etiquette, and discourage children from using each other's cups and eating utensils. How can we help involve children and encourage their participation? It's important to remember that we need to think about creative ways children can still have some fun and enjoy playing where possible. Making the most of our outdoor space is one of those. The evidence indicates that transmission of coronavirus is much less outdoors. So if we think about games, sports and activities that children can do individually, in pairs or in small groups while socially distancing. Try to take a playful approach based on responding to children's needs and wishes, and ask the children to come up with their own games. We also need to have a simple supply of equipment and things to play with that can be disinfected in between use. Moving on to step 5, what can staff encourage parents and communities to do to help? Inform your parents and communities about the measures that you're taking. It's vitally important to ensure that clear communication with parents regarding measures being taken to ensure the safety of their children. Encourage parents and carers to talk to their children about coronavirus, social distancing and the importance of hand washing and the techniques. Discourage parents and members of the community from gathering at the entrances. Encouraging the modelling of social distancing so that their children will learn good practice, and inform their childcare setting if their child becomes unwell, is tested positive, or a family member is isolating, tested positive, and discourage the bringing of any unnecessary toys or equipment to the setting. Nothing comes into or is taken from the pod room setting so as to avoid cross-contamination. However, some children may require a transitional object or toy as a comforter, and consideration should be given as to how to safely manage this to ensure that children are supported in their transition from home to the setting to feel reassured and comforted. Regarding family staff going on holiday abroad, each project will need to develop individual policy procedures, taking into consideration government guidelines and advice, and update accordingly. And we need to continue to monitor the Family Support NI site and Public Health Agency guidelines and update as and when required. And just to remind you, the guidelines are subject to change and you are asked to consult the Family Support NI website at regular intervals for any changes. Another thing you could share with the parents are the Department of Health Childcare guidance for parents. of all the children in your setting. Thank you.